Hernia occurs when a weakness in the abdomen allows the internal tissue to produce fluid. And in the case of an incisional hernia, such a weakness is due when incompletely healed incision is actually happening after abdominal surgery. So the standard procedure to solve this problem is actually to implant surgical meshes, as you can see on the right. And what you want is that this mesh to be applied without tension, but such on this corner. And you do want to have some integration with the muscle layer after some days, but no adhesion with the intestines. So most of the materials which are used right now are made of synthetic materials, and this is, for example, polypropylene, polyethylene, or UPTFE, which is Teflon. But unfortunately, they lead to high risk of complication, as, for example, adhesion with the intestines, chronic inflammatory response, low mesh incorporation with the muscle layer, infection, and finally, recurrence. So some kinds of material which are sometimes used are the biological one, and they can be cross-linked actually to play on the speed of degradation. But due to their elevated price, these materials are mostly restricted to high-risk surgery, as for example when the surgery is performed with an open abdomen or in contaminated field. So in our laboratory, we wanted to see if we could design mesh structure with plant fibers. That could be useful because plant fibers are widely available and they are quite inexpensive. So we mostly studied flax fiber. Flax fiber have good mechanical properties. They are non-biodegradable. They are mostly composed of polysaccharides since it is mostly cellulose. And actually they are hollow in the inside, which means that in the future we could try to put drugs in their lumen for a future release in vivo. So flax fibers are obtained followingly. After their growing phase, they are retted, which means they are laid out in large fields to allow the rooting of their inner part. And then the flax fibers are extracted from the plant, they are washed and they are combed to clean them. And then they are combined into a thread whose thickness can vary depending on the application you want to use them in. So we first start by assessing the biocompatibility of bleached flax fibers. So these flax fibers are bleached with hydrogen peroxide to remove their lignin, waxes, and pectin components. And that results in highly white fibers. And then we decided to knit them into a mesh. So we went in Belgium to do this, and actually because flax fibers are very flexible and because there is lots of know-how about how to knit them, you can actually design any kind of structure that you want. And we decided to knit them into a polypropylene mesh. So we first start by doing in vitro analysis using fibroblast cells from mouse. And what we could see is that when these cells are incubated with our material or extract of materials for 2 days, only 42% of them are still viable. And similarly, when these cells are put in close proximity of our material for 3 days, we obtain a disrupted layer of unhealthy cells, similar to the structure that you obtain when these cells are put in close proximity to latex, which is actually a known toxic compound. But if you see this polypropylene mesh, when it is incubated in close proximity to cells, you can see that we obtain a monolayer of healthy cells, which is what you want to have. So of course you cannot work with such a material, and we wonder how we could make this material more biocompatible. So we knew from previous experiments that actually a treatment with acetic acid could help in improving its in vitro biocompatibility. So we first treated it for 24 hours in a succinate with acetic acid, and then we decided to treat it with ethanol for 24 hours, because we thought that part of its toxicity could also be due to the presence of endotoxins. So if you remember well, in the introduction, I told you that actually to obtain a flax fiber, we need to red them. And of course, this process widely involves bacteria. And endotoxins, which are part of the external membrane of these bacteria, are actually extremely toxic and also extremely stable, which means that even after bleaching and even after steam sterilization, you expect that you will have a high amount of them in the fibers. And the common way to remove this endotoxin is to treat the mesh, or a material actually, with ethanol. And so we designed these two tandem treatments. We use the sock slat. So you can see here the flask which contains the solvent, and here the material to be extracted. So in our case, this is flax mesh. So actually the solvent is getting evaporated and is condensating and is falling down on our mesh. And in 15 minutes, you will have one cycle, and then all the liquid will actually fall down into the flask. So it allows you to have, in 48 hours, a high number of extraction, and every time you use new pure solvent. So you expect that you will have very purified fibers. So we did the same experiment again, and this time we could see that when the cells are incubated with extractor for material for 2 days, we have 100% of viable cells in comparison with reference. We could also see that when the cells are put in close proximity of our material for 3 days, we obtain a monolayer of healthy cells, similar to the one which was obtained for polypropylene mesh. When we do cell proliferation, we can see that we have actually a lag phase of 3 days, but that after this, the cells start to grow at the same speed that the polypropylene mesh, so it doubles every 50 hours. And in comparison, when this mesh was non-treated, we could see a much longer lag phase of 2 weeks, and then cells start to grow, but they double only 150 hours. So before implanting this mesh in animals, we wanted to be sure that the level of endotoxin was as low as possible. And to test this, we used a LAL test, which is a standard test to use to dose the number of endotoxin, and is FDA approved. And we could see that before treatment, our mesh contains high number of endotoxin, so more than 10 endotoxin units per mesh in total, and most of these endotoxin are extractable. But after Soxhlet treatment, this amount of endotoxin is much reduced, and most of them are actually non-extractable. We also confirmed this experiment with results doing XPS analysis. So we could see that before treatment, we had high amount of carbon without oxygen neighbor, so 71%, whereas normally you don't have this kind of carbon in pure cellulose. And as a consequence, you could see that the percentage of carbon on fibers was also extremely elevated as compared to what you should have on pure cellulose. But after our treatment, we could see that the percentage of carbon without oxygen rainbow was much reduced, since it was only on 25%, and that also the percentage of carbon was more similar to what should be obtained for pure cellulose. And we believe that this is due to the removal of endotoxins. So here I show you the lipid A part of endotoxin, and you can see that you have high aliphatic chains. And of course, if you remove these aliphatic chains, you also decrease the amount of carbon without oxygen neighbor. So then we implanted our material in rats subcutaneously for 7 days to analyze the acute inflammatory response. And we stayed them with eosin and hematoxylin. So here you can see a flax bundle, and you can see that these flax bundles are actually composed of independent flax fibers. And here, if you look well, you can even see the lumen of this flax. We would like to put drugs in it in the later work. So macroscopically, we could see small fibrosis with no pus formation. Microscopically, we can see that we have a low inflammation with small foreign body response. We have few macrophages and few granulocytes, But if you look inside the flax fibers, we have actually necrosis. So we believe that what's happened is that actually macrophages succeed to go inside the flax bundle, and then they become trapped in it because they cannot go out anymore. And of course, inside the flax bundle, we don't have blood vessels, so they die because of the lack of nutrients and oxygen. So to actually improve the response in vivo, we designed new mesh, because our mesh before was actually a heavy white mesh. So now we obtained this mesh, which was obtained with a smaller fiber diameter and which has a more open structure. And we would like to implant it in the very coming month. So as a conclusion, we can say that the in vitro biocompatibility is achieved. That the surgical ending is favorable because this mesh can easily take the shape of the defect you want to correct. But the in vivo biocompatibility still leads to some issues regarding necrosis inside the flax bundle. As a future work, we would like to implant in vivo this new mesh with reduced fiber diameter and more open structure. We would like to do it in rats and then in pigs. And we would also like, in another approach, to actually put a coating on top of it. We would like an anti-inflammatory and antibacterial drug like propolis to stick to a green mesh. And we hope it would attenuate the immunogenic reaction. So I would like first to thank my fellow partners who helped me along this project, especially Mr. Jan Vermesch, which is kindly giving us the flax spools, and we actually need quite a lot of flax to have this mesh. And we would also like to thank the funding partners, and especially the European Union, which is giving most of the money for it. I would like to thank you, and if you have any questions, please do not hesitate.
Madam Michel, thank you. An interesting approach for alternative hernia mesh materials. I guess my first reaction when I'm thinking of flax is that we have a polysaccharide, a cellulose-based material here, and I guess my experience with that is that it's highly thrombogenic, and I'm interested in knowing in your animal study if this was an issue that concerned you or that led to a certain level of thrombosis initially during your healing period. I wasn't clear, for example, with the histology, what the period of implantation was for those images.
Okay, so we implanted our mesh for 7 days. It was just to see really the acute inflammatory response. We wanted to see if actually the purification process was efficient or not. Because we have seen also that this other mesh before treatment was extremely toxic in vivo. So we made a thrombin generation test, but we made them in vitro, and we could not see a difference as compared with the polypropylene mesh. So it was the same time before thrombosis to start.
Okay, thank you. And your last comment was you're going to look at immunogenic response. Do you expect some sort of immune response? Because I'm not familiar with that, with this type of material.
I don't understand, I'm sorry.
In your future work,
yeah.
You refer to an immunogenic study.
Yeah.
And all I'm saying is, do you anticipate there to be an immune response to this particular cellulose implant material?
So we would like to implant it, as I said, in rats and pigs, and we would like to use for this a proper hernia model. And then we would actually stain more, so to be able to see collagen 1, collagen 3, for example. We also work with pathologists, so they are quite experienced to actually detect the immune reaction. But that would be a much more surgical paper, I would say.
Sure. Okay. No, but I seriously do not expect you to anticipate a change in the immune response from this material. But
no, we don't expect a change. We expect a decrease in immune response because it will have a more open fiber diameter. So as you know, the more heavyweight the mesh is, the higher the immune response is also. But we don't expect to have less problems, I would say.
Thank you.
You're welcome.
I guess we know with polypropylene meshes, they're fairly a hydrophobic material,
Yeah.
Which is one of the reasons, I guess, that we get such an intense inflammatory response, because we get all that protein absorption.
Yeah.
I guess with cellulose, it's a pretty hydrophilic type material, so I would expect that you would see a much reduced inflammatory response just because of that reason. Any kind of material that we can use to replace the polypropylene material that's currently being used, I think, is really good. So this kind of work is...
Yeah,
good stuff.
well, thank you. Of course, yeah, if you look at bacterial cellulose, which is also implanted now since, I would say, 5 years, you can see that the immune response is actually much better. So we expect, of course, that's also why we are working on this cellulose-based material, because we expect we could reach same kind of immune response in vivo.
Okay.
Thank you.